Hello, and welcome to this brief presentation on demystifying mental health. My name is Matt Gamble. I'm a licensed professional counseling resident in the state of Virginia, which means I have my master's degree in clinical mental health counseling from Southern New Hampshire University. This is the first video of a series I'll be doing on mental health concerns and methods to improve mental health. I'd also like to focus some on producing some videos on how to approach mental health care. There are a lot of different providers out there, each kind of having their own little specialty. So we'll talk some about that in a future video. But for this video, I would just like to focus on breaking down some concepts of mental health, kind of what mental health is, the influence that mental health has on our overall health and well-being. So with that being said, we will just move along. So our learning objectives for this video is to define mental health, look at some cultural considerations of mental health. So how does a person's culture influence their mental health and the mental health care that they receive, and some overall things that a person can do to improve their mental health and well-being. So there are four primary dimensions of mental health and wellness. This is them here: your overall physical health, your home, your purpose, and your community. So you see here that all of these here, the four I just listed, are influenced by your mental health and vice versa. Your mental health can influence those domains. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And here we're going to kind of dive in for just a moment on the cultural influence, the influence that culture has on mental health. So culture influences many aspects of mental illness, including how patients from a given culture express and manifest their symptoms, their style of coping, their family and community supports, and their willingness to seek treatment. In some cultures, it's common for mental illness to be seen as an internal family structure concern, and there is no need to seek outside support. The culture of the clinician and the service system influence diagnosis, treatment, and service delivery. Minorities are much more likely to receive a major mental health diagnosis when compared to the same symptom presentation with social and cultural majority Caucasian populations. And what that means is you're much more likely to see a person of African American descent diagnosed with a major mental health condition such as bipolar disorder, schizoaffective disorder, schizophrenia. Those are all major mental health diagnoses that have different outcomes. They're much more difficult to manage than, say, depression or anxiety. But unfortunately, stigma discourages major segments of the population and the majority and minority alike from seeking help. Even though there are federal and state statutes in place that prohibit the needless giving of a client's records. So within the healthcare field, both mental health and if you go to see your primary care, your information, everything that they write down about you is protected by the Health Information Portability and Accountability Act, which is a federal statute signed by Bill Clinton in 1996 that prohibits the careless distribution of your health information. An example of this would be if you've ever called a hospital and the person at the other end says something like, I can neither confirm nor deny that that person is a patient here. That is them exercising their HIPAA statutes. So HIPAA protects the information of the person that you're calling to check on, but know at the same time that were you a client in the hospital, they would be required to give the same response. And that protects your health information. Let's see. So there are multiple methods to receive mental health therapy. There are psychiatry to counseling. and therapy services. So a psychiatrist prescribes medication. There seems to be a lot of confusion about what a psychiatrist, a psychologist, and a therapist does. So a psychiatrist prescribes medication, generally spends 15 minutes talking to you, hands you a prescription for a medication or calls a prescription in. A psychologist is a person who generally in most states is required to have a PhD in clinical psychology, and they will do a lot of the same things that a counselor will do, but psychologists tend to administer a lot of assessments and tests. Those are written assessments that in the end tell us a little bit more about what's going on with your mental health. So counselors, which is the area of mental health that I fall under, and therapists engage in talk therapy. We dive into the feelings that you're having regarding what's going on in your life. You know, what's your presentation, what's your complaint, we'll say, just for the sake of easiness. It's easier to think of what you're coming into therapy for as a complaint, presenting complaint. So, you know, you've been feeling more anxious, you've been down, depressed, just something not right in your life. So we discuss those and help you dig into where that may be coming from. So all of those forms of mental health treatment may be accessed by virtual methods today. Counseling and psychiatric services, to include medication, can be prescribed with a virtual, like Zoom visit. So there are some methods to improve your mental health. You can get professional help from someone that I just mentioned, a psychiatrist, psychologist, counselor, or therapist. Connecting with others. So much like cattle, horses, sheep, and goats, humans are herd animals. We need meaningful contact with other humans for our own mental health and wellness. There was a very interesting study done, I think in the 60s, and I'm not quite sure exactly where it was at, Harvard, Yale, perhaps somewhere there, but it was an experiment with infant monkeys. So one monkey gave birth to an infant, and the infant was allowed to remain with their mother. Another infant was born, but their mother died during delivery. So instead of partnering the monkey without a mother to the other monkey who had just given birth, the researchers decided to swap out the now deceased mother with just a stuffed animal of what appeared to be a mother monkey. So what they found was that throughout the course of its life, the monkey with the replacement mother, the stuffed animal, fared much worse than the monkey that was allowed to grow up with its actual mother. And so emotional contact was withheld from the monkey whose mother was a stuffed animal, and overall the life expectancy of the monkey went down considerably, whose mother was a stuffed animal. And that just kind of circles back into this, that we humans are herd animals. Like I gave the example of cattle, horses, and sheep. We need contact with those like us. Let's see. Staying positive. Positive mental outlook is beneficial in that our mind listens to what we tell it. If we are always telling ourselves that we are worthless, fat, ugly, or insignificant, then our brain is going to believe that, and that's going to lead to a very negative outlook and to somatic symptoms. Somatic symptoms are bodily ailments resultant from a negative mental outlook. You can technically think yourself into a medical condition just by having these very negative thoughts. So one thing we can do to combat mental illness, like say depression and anxiety, is exercise. Exercise has the ability to increase the level of serotonin and dopamine in our brain, which is linked to a variety of benefits. Numerous studies have found that exercise boosts mood, lowers stress level, and even improves cognitive function like attention, memory, and problem solving. Helping others is another great way to improve mental health. Volunteering to help others is correlated with improved mental outlook, feeling of purpose, and helps to improve our outlook of the world. So by doing good, we in turn feel good. Sleep. Sleep is a huge thing with mental health. Decreased sleep causes irritability, decreased cognitive function. And cognitive function, whenever you hear the word cognitive, think of thought. Cognitive function has to do with decision making, reflexes, and cognitive delay, which is slow thinking. The development of coping skills is something that we'll talk about in future videos. Coping skills are techniques offered by mental health professionals to increase a person's resilience against the symptoms of mental illness. So, whereas a psychiatrist would offer medication, therapists and counselors offer coping skills and techniques. We spend a lot of time in therapy discussing things that you can do to reduce, be it anxiety or depression. And then we ask that you just take those with you and practice them, come back, let us know how it's working. If it's not working very well, then we switch things up. So I hope in future videos to discuss anxiety in the workplace, depression in the workplace, how to access mental health care, and I spoke very briefly about that in this little presentation. Self-care. Self-care is something that I harp on with a lot of my clients. What are you doing to take care of yourself? So self-medicating, substance use disorders are big in the workplace, unfortunately, today. So what does self-medicating look like? And what does a substance use disorder look like? It's not exactly what you think it is. And burnout. Burnout is becoming a major thing across all fields, all specialties. Everyone from grocery store clerks all the way up to medical professionals are experiencing burnout. We will discuss in a future video the causes of that and what you can do to help prevent or lessen burnout.